Lots of children and adults get low back pain from time to time, and it mostly improves by keeping active. But low back pain in young athletes is different. The most common cause of low back pain in a young adolescent athlete is a bone stress injury. And we used to call these injuries stress fractures, but many athletes don't actually get a fracture. It's more of a bone bruise, which is quickly reversible if you do the right things in the early stages. Bone stress injuries are caused by a spike in activity that exceeds the current capacity of the body. That might be because the child did too much too soon, or it might be because they had a lower capacity than usual due to a virus, a growth spurt, lack of adequate sleep, vitamin D, or maybe inadequate nutrition. The bone is really clever. It responds to stress placed upon it by making more bone. But that process, however, takes time for that new bone to mature and become strong enough to withstand more load. If the child does more than they're used to doing, the bone becomes bruised, and the young athlete may get intermittent low back pain on playing sports. If they rest at that stage for just a few weeks and let the bone catch up, the bone bruise will heal. But if they ignore it and they carry on playing, the shell of the bone might develop a small hairline crack in the outer surface, which is not serious, but this now, instead of taking just a few weeks to heal, can take a few months. If at this point they still don't listen to those signs and symptoms of low back pain and they keep playing, they're at greater risk of going on to develop a stress fracture. The one big rule in children is that none of them should play sports with low back pain. And I'll say that again. No child should play sport with low back pain. If we can get the early diagnosis, we stand a much better chance of getting these kids back to sport quickly without having all the frustrations of a season missed through injury. And we see more of these injuries in children. And the reason behind that is because a small bone in the lower back does not fully mature until the age of around 23 or 24. So during growth spurts, it elongates, and for a short while, it gets temporarily weaker, making it more susceptible to injury. So once kids have gone through this age, they tend to, unless they're in sports specifically like cricket, tend to find that this is more something that occurs in adolescence rather than being that frequent in adults. So how do we know when the child has potentially got one of these bone stress injuries? Well, invariably, what we see is that the child will present with localized low back pain on exercise involving these repetitive overarching of the spine activities, such as throwing, cricket bowling, kicking, sprinting, and doing anything like throwing javelins or doing gymnastics. It usually starts on the opposite side to the one that they throw with. But if the athlete doesn't rest, it may spread to both sides and become more constant. It'll usually settle with rest. However, unless they get the right treatment, it usually recurs as soon as they go back to sport. So this is a symptom whereby it's pain on activity and it eases with rest. So just to be clear there, that's very different from the type of back pain that we see perhaps if you've been sitting all day when you're at the computer, which actually improves with activity. So trying to get kids to do less is never popular. So trying to find a way to increase their capacity to tolerate more activity is preferable. Building stronger muscles and getting more sleep, improving their energy intake, and factoring in days where their body can adapt and recover will all help. After the pain settles, be careful not to send them straight back to doing what they were doing before. Following a bone stress injury, the child needs to get stronger. They need to address any technical issues with perhaps a throwing or running action and build back up to sport gradually, or the bone stress will just recur. If after 2 weeks of trying to reduce their symptoms down, your child is still in pain, it's often helpful to see a health professional who has experience in treating young athletes. Not all practitioners have this knowledge or expertise, so make sure that they are either on the Kids Back to Sport register or ask your local therapist whether they regularly treat children with bone stress injuries. There's a booklet on the Kids Back to Sport website on low back stress fractures, so take the time to download that and learn more about this injury.